Wildlife Health Cornell represents an unprecedented approach to the health challenges wild animals face around the world. A comprehensive, science-based response by a team of the world's top wildlife health experts. A shared sense of mission and a shared passion for wild nature nurture our efforts to foster real change for the better. Wildlife Health Cornell has grown out of our palpable sense of genuine urgency regarding the fate of our planet's wildlife, an increasing understanding of our own dependence on the planet's natural systems, and a recognition that it will take a new generation of highly trained colleagues to halt and reverse the trends we currently face. Cornell today is very much about impact, about teamwork that capitalizes upon the vast array of expertise available across the university, and about engagement. We hope you find this morning's session useful, thought-provoking, and perhaps inspiring.
Good morning, Cornellians. I'm Mike Kotlikov, the provost of Cornell, and it gives me great pleasure to have a part in overseeing this discussion about a new program at Cornell that I had a small role in thinking about and getting started, but as I always say in the laboratory, ideas are cheap. And it's really the doing the experiments, applying the information, and building programs that makes the difference. And so it's terrific to be able to introduce today some of the individuals who are actually doing that. I also want to start by acknowledging Dean Lauren Warnick, Dean of the Veterinary College. Lauren. And David Lodge, Director of the Atkinson Center for a Sustainable Future. David? So these two individuals are really critical in making this program work. We're fortunate today to have 4 distinguished veterinary college speakers with us. Each of them has had decades of experience in wildlife health and conservation. They have expertise on issues affecting a multitude of species around the world and critical threats. Dr. Steve Osofsky, the J. Hyman Professor of Wildlife Health and Policy and a 1989 Cornell graduate, leads the new Wildlife Health Cornell Center of Excellence. Dr. Beth Bunting, down at the end, is New York State's wildlife veterinarian, working closely with the Department of Environmental Conservation to protect native New York wildlife. Dr. Martin Gilbert, our wildlife carnivore health specialist, is an expert in health threats facing big cats, particularly the Amur tiger of the Russian Far East. And Ms. Shirley Atkinson works closely with Steve Osofsky on challenges at the interface of wildlife, livestock, and human health, and livelihoods in southern Africa, transfrontier conservation areas. So I'm honored to join these distinguished colleagues, and I'd start off this panel discussion by asking Steve to give an overview of this new program and tell us what it's about.
Well, thank you, Mike, and thanks everyone for making it here this morning. When I was relatively recently talking to Cornell leadership about coming back here, which is very exciting, I started to mingle with my potential colleagues to be, and I quickly started to realize that across the veterinary college there's an incredible breadth of work being done on the conservation of free-ranging wildlife, on wildlife health. We have colleagues, and we are representing a much larger group from the veterinary college. We have people working to save the last 50 Javan rhinos in Indonesia, the last 100 Sumatran rhinos. We have colleagues working on the impacts of invasive species in New York State's rivers and streams. We have a colleague working on shark genetics. We have work on tigers and other big cats around the world, our portfolio in Southern Africa. Beth will be telling us about the work across New York State. There is an incredible diversity of work, including by our students through programs like Expanding Horizons, where students get to go both domestically and internationally to immerse themselves in challenges at what we call that wildlife, domestic animal, human health interface. And Wildlife Health Cornell really sprung out of the recognition that we're not, to be candid, so far we hadn't been telling the world that Cornell is actually a center of excellence. And I looked across the veterinary colleges in North America, and I don't think there's a veterinary school that's doing more on the conservation of free-range wildlife or on the relationships between the stewardship of nature and our own health. And so now that we're putting it all together under an umbrella, we want to tell the world that actually this is something Cornell excels at. And I think no time like today.
Terrific. And so can you describe, Steve, a little bit about the program in Southern Africa, its history, your involvement,
Sure.
and where we're going?
Great. No, thank you. So I want to get a little bit personal. I got immersed in Southern Africa in the early 1990s as the governor of Botswana's first wildlife veterinarian. And when I hit the ground in the early 90s, one of the things that really struck me was that my colleagues working on livestock and the colleagues working on wildlife, even though they were working in the same areas of land, they weren't even talking to each other. They literally were working in parallel. And as I started to get to know Southern Africa, I started to see the incredible lengths of fences, physical barriers across the landscape. And I started to run into a lot of dead wildlife, dead zebras, dead wildebeest on these fences. And I guess I want to ask, how many of you have been on safari in Botswana or Namibia or Zambia, Zimbabwe? Raise your hands. Great. Okay. So I'm going to take you on a little historical tour, and you'll recognize some of the places I'm talking about. But I need to take you back to the history of this dilemma, and this will all make sense. In the late 1950s, the country of Botswana was a British protectorate. It was Bechuanaland. Zimbabwe, where Shirley's from, was British Rhodesia. Namibia was German Southwest Africa. And in those days, this was before diamonds were discovered in this part of the world. These were largely poor, semi-arid areas, and the colonial powers, primarily the British and the Germans, were trying to make money. They were trying to get economic traction. If you're a colonialist, that's what you do. And what they seized upon, to sort of compress history a bit, is the idea of getting beef from Southern Africa back to Europe, back to the motherland. But they knew, even in the late 50s, that there was a virus called the foot and mouth disease virus. And since most of you are veterinarians, and probably many of you learned about this virus from Dr. Poppensieck, as I first did, This virus is very risky for trade. You don't want this virus getting into your livestock. It'll shut down your access to markets. It affects, cloven-hoofed animals. But even in the late 50s, they knew that this virus resided in southern Africa, in the African buffalo. It's the only species in the world that harbors this virus. They don't really get sick from it, but they carry it. So to get this beef back to Europe, they started to build fences to separate the wildlife from the livestock. And over the ensuing decades, largely with subsidies from the European Union, from the World Bank, from our own government, from USAID, they built thousands of kilometers of fences across the entire region. And what I will say is that in the ensuing decades, what we had was really a slow-motion environmental train wreck, where hundreds of thousands, if not millions, of wild animals have died along those fences because they cut off the seasonally important migration paths. Those animals need to move seasonally to access fresh water and grazing. So we had this monosectoral decision focused on beef agriculture. In the 50s, 60s, even the 70s, wildlife was a valueless resource. So that's sort of the stage. That's sort of the bad news. But the good news is that today, nature-based tourism, nature-based activities contribute as much or more to the economic growth of southern Africa as agriculture, forestry, and fisheries combined. So the entire economics of the region has changed, and the heads of states of these countries that I mentioned, they have recognized this, and they are now turning to wildlife as an engine of economic growth. And what they've done are they're creating peace parks. About a dozen trans-frontier conservation areas or peace parks, which, for those of you who don't know, it's when 2 or more countries agree to recreate those corridors across an international boundary, those historic migratory pathways between, say, a national park in Botswana and a game reserve in Zimbabwe, so that wildlife can rebound, because all the wildlife numbers are going down, largely because of those fences. But the motivation here is economic. So they're creating these peace parks, and if you add up all the surface area in southern Africa now, either planned or underway as a trans-frontier peace park, it's about the same surface area as the state of New York, the state of California, and the state of Texas combined. This is the biggest experiment in terrestrial conservation on the planet. And when we got involved in this almost 20 years ago, I was saying, okay, this is great, but what about the fences? You cannot do any of that unless you deal with this beef problem. And so we came up with, over the years, a way, basically not rocket science at all, focused on how you process the meat rather than whether your next door neighbor is a buffalo. And so if you degland the meat, you take out the bones, you let the meat age as you do to produce a high-quality state, the pH goes below 6, you veterinarians know this, foot and mouth disease virus can't survive. But what took us so many years is to get the World Trade Organization, through the OIE, the World Organization for Animal Health, to accept that meat processing was equivalent to fences. And in 2015, largely due to work of colleagues like Shirley and our friends in the region, the global community voted on this in Paris at the OIE World Assembly, and they changed the rules. So now you can process your meat, and this gives us, for the first time in generations, in 70 years, an opportunity for the poorest farmers to be able to have that win-win. They can finally trade their beef and benefit from this boom in nature-based tourism. So we have been at the center of land use planning and policy all through the veterinary entry point. And I'm going to defer to Shirley to talk more about how this is impacting regional livelihoods and poverty. It is one of the most exciting opportunities I've ever had the honor of being involved in, because it's got such implications at scale. This problem is across southern Africa and, in fact, extends into other parts of the world like Central Asia, where foot and mouth is often the big conflict between these two sectors of the economy. So we're really excited to finally be seeing this policy change. And now, with support actually from the Atkinson Center, we are starting to work with farmers to implement this beef processing approach so that they can succeed, and then we can look at realigning or even removing some of those fences. It's very exciting.
So Shirley, you grew up in Zimbabwe, worked with farmers, veterinarians, wildlife conservation departments. Can you talk a little bit about the tensions there and how this is working?
Yeah, I mean, like as Steve mentioned, where you've got this duality of land use, where you've got wildlife and livestock on the same place competing, it really does create tension, and it's oftentimes that they clash head on. And really, they weren't talking to one another. And a healthy lot of skepticism when we started to have these discussions with the veterinary services through livestock and with the wildlife. We were obviously coming at it looking at how can we try and find a better mechanism for wildlife, but also recognizing that the livelihoods of people are critical. And it really took us many years to create, I'd say, instead of sort of barging right in and we've got the solutions, to sit down and build a level of trust with the livestock sector. At the beginning, they weren't even prepared to come to the same table as the wildlife people for fear that we were actually setting them up for something. But slowly, over time, we started to be viewed as the honest broker because we tried to sort of take a step back and try and create an environment for people that felt safe, a neutral area where they could come together. And we used health as the entry point, something that could be seen as neutral as opposed to coming at it from the disease perspective. How can we ensure health of people and livelihoods? How could we ensure that maybe a product that we were hoping could be exported regionally, beef in this case, didn't pose a threat to other people's cattle industries? And how do we find a healthy environment where wildlife can actually migrate, again, over these areas? And slowly we were able to build the trust and bring people to the table where wildlife and livestock are actually having these conversations now, which is really exciting. And I think of an example here in the US where you can see that type of sort of acrimonious debate taking place. If you think to the Greater Yellowstone area and you think of what is happening there, cattle ranching is incredibly important for people that live there economically and socially. But you've got brucellosis and the issue with it being maintained in bison and elk. And so you have oftentimes these real tensions and trying to break that down where you could get people to the same table. But we've made some significant headway, and it really is just a very slow process about getting people to the table. And I think instead of looking for the one fast solution, it's trying to look at it more holistically and coming up with solutions together.
And what is the role of the center now in that process? Is it research? Is it convening? How is the center interacting in that effort?
So we've really been sort of the glue, if you will, on taking the science of this new approach and translating it with our Southern African partners into a policy prescription. And this is all driven, by the region. We are not out front. We are, basically creating that enabling environment, taking the science, getting it into policy, and helping that get into action. And so now we are doing training, we are doing convening, and then we've got to demonstrate that this is going to be safe, so that the livestock authorities and the OIE and FAO remain comfortable with it. We just convened a huge meeting a few months ago that FAO co-sponsored on this idea, got huge buy-in. So a lot of it is being a convener. And I'd say it's 20% science and probably 80% biodiplomacy and patience. But it's grounded in hard science, which is critical in terms of what we're trying to achieve. But so much of it, as Shirley alluded to, is about trust and relationships, which is very time-consuming, but that's really the only way to affect sustainable change.
Let's shift gears a little bit. Martin, you've been working on this outbreak of canine distemper in the Russian Far East that's endangering and killing large cats. Do you want to talk a little bit about that issue and how we're involved in that problem?
Sure. So I guess the story really starts back in 2003, late 2003. A young female tiger, lammer tiger, entered a village, which happens from time to time. There's occasionally conflict issues occur over there with tigers, which are maybe struggling to survive in the wild, will come into the edge of villages to take dogs. And Morka, however, was unusual. She showed an unusual sort of disassociation with her surroundings. She appeared blind. When the rangers got there to immobilize her, to move her out to that area, they realized that she was sick, and they brought her into captivity. And over the sort of following 5 or 6 weeks, she was given supportive care, but subsequently died in early 2004. And samples from her went back to the United States. At the time, there's very little in the way of diagnostic resources out there in the Russian Far East to process those samples. Ultimately, she was confirmed as a distemper case. That was the first distemper case in a wild tiger. There had been some history in other big cat species. Some of you might be aware in the early 90s, there was a couple of outbreaks, one very large outbreak in lions in East Africa in the Serengeti, that over the period of the outbreak, about 1,000 lions, about a third of the lions in the Serengeti disappeared. So initially we were really quite alarmed at what this new change in the Russian Far East, this new event in the Russian Far East, what it might entail for the tigers. But because tigers are very different than lions, they're not so social, there's much less contact between individuals, we thought this may just be an incidental spillover with one case affecting this one individual, with very little chance for it to spread through the population. And sure enough, nothing really happened after that until early 2010. And during the first half of 2010, we had a number of cases occurring in exactly the same picture, animals that had lost their fear of people. There's videos on YouTube of one of these tigers along a road bumping into cars. Another one was a well-studied, one of our collared individuals that had been studied for the length of her life. But the alarming thing here was that these cases were over a very wide area. So tigers occupy an area of roughly equivalent to the size of Illinois. And we had 3 cases suspected or confirmed, basically at the full extent of that range. So we were looking at something that wasn't local. So we became much more alarmed at that point. And our first question really is distemper something we need to care about at a population level? Obviously, it's an issue for an individual tiger that's infected, but is there the capacity here for the virus to impact the conservation status at a population level? Now, fortunately, the subspecies have been very well studied in the Russian Far East. We had very good information on the sort of biology of tigers, and so we put together a computerized model, an epidemiological model, to look at the survival of tigers, to build a sort of population of virtual tigers in the computer to see, it's essentially replicate how they live in the wild. They're getting born, they live, they die, they breed in the same way as they would in the wild. And then introduce distemper and see how the introduction of distemper, even at very low levels of exposure, whether it could impact the population. Which, to cut a long story short, it certainly could, particularly for as you reduce the size of that starting population at the start of the model, you could see that those populations were disproportionately likely to fall to extinction, which is worrying, particularly as tigers across their range, I mean, they used to cover very large, vast areas, but as human populations have increased, those populations of tigers are gradually getting more fragmented and more sort of hemmed into smaller population sizes. And so where you may have a large population that can survive distemper and withstand outbreaks, those small populations now become vulnerable to sort of stochastic extinction from the virus. So our next step really was to understand the epidemiology of how the virus is being maintained in the environment, and what species were responsible for as sources of infection for the tigers. Now, really, because we knew with the model that this is something that we needed to be concerned about, understanding the epidemiology becomes critical to designing management strategies that we can deal with it. Now, there's a number of different potential susceptible hosts. Dogs were initially of primary concern. We thought they were the most likely sources of infection. But of course, there's a wide range of other carnivores in the Russian Far East. And so over 2 or 3 years, we intensively studied sort of the biology and the disease exposure in both the domestic dog populations and the wild carnivores. We collected as much information on where dogs and wild carnivores are living, what their population trends are. And as it's turned out, all populations are exposed to some degree, but rather than domestic dogs being the main problem from the tiger's perspective, we do actually think it's wild carnivores. So every year that we were going looking, we would find the virus in particularly very sort of marten species, small mesocarnivore species, also raccoon dogs, foxes, badgers, these kind of species in the forest there's enough of them to be maintaining the virus and acting as a sort of constant spillover source for tigers. And so really where we are now, in order to manage the virus, really our only option is to focus on the tigers themselves. We know that we can't manage the infection in the domestic dog population, which would have been the nice, easy win for us. It would have been a win for village dogs, improving the health of village dogs, and also having a knock-on for tigers. But unfortunately, from a management point of view, our only possibility is to look at the tigers themselves. And so we've now been working with other partners, particularly folks at the University of Tennessee, to look at the safety and the efficacy of vaccines in tigers, and to go back to our model to start to work out how we would put together vaccination strategies that could remove this extinction risk from distemper. And the good news is that the modified live vaccines that we would be giving to domestic dogs in practice, those are effective in tigers. They raise an antibody titer as we'd hope, and they're also safe in tigers. So, and more to the point, with our modelling work, we've been able to go back to look at how we would deliver that vaccine to wild tigers, because obviously it's not like tigers in a zoo. It's very difficult to deliver vaccine, and so we would expect only to be able to vaccinate a very small number of tigers annually. But even just vaccinating a couple of tigers a year would be sufficient. It would raise enough immunity in the population such that they could withstand future outbreaks and essentially eliminate that extinction potential from distemper.
Can I just underscore something that is a theme I want to make sure we bring out? There's an urgency here, and we're immersed in this, but I realize a lot of you are not immersed in wildlife conservation. In the early 1900s, there were probably 100,000 tigers on Earth in the wild. There are just around 4,000 now. That's more than a 96% decline. Only about 400 or so in the Russian Far East. Where we're working in southern Africa, it's the last stronghold of the African elephant. 150, 200 years ago, there were millions and millions of African elephants. We're down to less than 500,000 elephants, the majority of which are where we're working. Lions, in the 1800s, which is the blink of an eye from a geological point of view, in the 1800s, we think there were more than 1 million lions in Africa. There are maybe 20,000 left. And so, as Martin said, as these populations get smaller and smaller, the health threats can be what tip that last domino towards extinction, which is why this work is so important now. Hundreds of years ago, these issues probably would have been part and parcel of the system, but now these populations are more vulnerable than they've ever been.
Great point. I guess the other observation I would make is this story highlights the need to, first of all, understand the disease, make the diagnosis, understand the epidemiology, and where the virus resides, and then craft a remedy, a treatment strategy that, again, depends on knowledge of the species and something that can be effective. Beth, would you tell us about, Beth Bunning, the New York State veterinarian, wildlife veterinarian, would you tell us a bit about the program in New York State and its unique features?
So it's always hard to follow these guys when you work on muskrats in Schenectady. It's a bit of a tough sell. Students come to me and they're like, but Martin has tigers in the
And
Far
you have
East."
salamanders.
And I'm like, but muskrats, Schenectady.
There's nothing wrong with muskrats.
Muskrats, pays the bills. So this program started in 2010. The New York State DEC, every state has an environmental agency that's responsible for game management. And I was not aware of a lot of how that was structured. There's something called the public trust concept, which means that these agencies are responsible for managing all of the wildlife in the state in trust for future generations. And I always sort of thought of the state agencies as really being game agencies for the most part. They were hunting agencies. And I think they also saw themselves as, just getting some feedback, really not having to deal with disease particularly. They had not really seen disease very much impacting wildlife populations, and they're working at a population level. But what had happened in New York over a period of years, and those of you who are older than my students at this point will remember the introduction of West Nile virus. That was discovered by a veterinarian at the Bronx Zoo in 1999, pathologist who realized that her birds were dying of an encephalitis, and she looked into that and figured out that this was a brand new disease that had significant public health and human health impacts. And then after that, they had an introduction of a disease that's in deer called chronic wasting disease that's very similar to mad cow that happened in England. And then also another one called white nose syndrome, which is a fungal disease in bats. And so it really got their attention, particularly the bat disease, because that disease is projected to eliminate the little brown bat population, which used to be one of the most populous bats, particularly in the Northeast, and they're important insectivorous bats in control of some agricultural pests in particular. And what they realized was that they didn't have the tools or the staff really with the expertise to help them with those things. So they came over to the vet school and they said, we think we need some sort of comprehensive health program. And I was sort of surprised when I looked up some information about health programs in states with wildlife agencies, and there are only 15 veterinarians in the whole country that work for state wildlife agencies. So it's really not a relationship that's been established. There's not a lot of history there. So even though these guys are talking about working in Southern Africa, we had a lot of the same challenges there with talking about how do we meld these two things? How do we bring veterinary medicine into the state agency and help them with their mission? Because we didn't really have a blueprint for that. So we set up the program, and the primary aspect of the program is really to do surveillance. And so we look at about 1,200 wild animals a year for them and do data analysis. We're looking for patterns in what are standard patterns of disease that go on so that we can figure out when the next West Nile virus might show up. And then we also help them with research projects and regulatory support that they need to make arguments when they need to put regulations in place. And we do a lot of staff training. So if I need to send their biologist out to pick up a potentially rabid animal, I want to make sure that that person is not going to be eating a bologna sandwich with one hand and throwing the raccoon, in the truck with the other hand. We tried really hard, too, to engage the biologists because there was not a lot of buy-in at the beginning as to what was the point of this. I think there was a lot of perception about veterinary medicine. I think they were concerned I was going to show up perhaps with little crutches for squirrels or something along those lines. And so we worked really hard with the biologists. I ate a lot of deer jerky, had a lot of barbecues, and brought a lot of donuts. To try and convince them that we could help them. And I think we've made that case for them. They've seen how veterinary medicine can contribute day to keeping them safe, to helping them with disease detection for wildlife, and then also for human health. We work a lot with rabies cases with the health department. So that, I mean, the program has been in place now for 7 years, and we just got our contract renewed last year, so we have another 5 years to continue building.
So what are the major issues that you're working on now in New York State? What are the risks? What are the threats that you're seeing?
So there's some things that we really want to raise awareness about. One of the first things that we wanted to do was analyze the information that we had. You know, at the time that we came on board, DEC had done a lot of analysis, but they hadn't really put it together. And so when we started doing analysis, we realized that about 20% of the bald eagles in the state were dying from lead poisoning. And that was pretty interesting because I knew from being a wildlife rehabilitator that lead shot for waterfowl hunting had been banned in the 1990s at a federal level to try to prevent lead poisoning in wildlife. And so the fact that 20% of our bald eagles were still dying from lead poisoning was pretty interesting. And what we think is happening is that they're actually scavenging other animals that have been shot with legal lead ammunition that are being left out on the landscape by hunters. And so that's a program that we're trying to work on with the DEC, because as you can imagine, anything that relates to guns and ammunition is a bit of a hot button political issue.
Really?
Yeah. So on the last day of the Obama administration, U.S. Fish and Wildlife Service tried to put in place a rule to prohibit the use of lead ammunition and fishing tackle on federal lands. And I believe in the first week of the Trump administration that was flipped back the other way. So we're trying to do a lot of education, particularly with hunters, because we started thinking about it and we thought, well, if the bald eagles are eating it, aren't the hunters also at risk of eating it? And so it turns out that if you look at what happens when someone shoots a deer, there is a fairly high risk of them ingesting lead particulate, lead shot. And because these families will often shoot a deer and then consume that deer repeatedly, like over the course of the winter, a lot of them use it for food, they have a risk of repeated exposure to lead. And then we started thinking about there are huge donation networks for venison for food banks. And we got into some conversations with the health department about how do you message that, because we don't want to take away that food supply. We don't want to take away that ability of people to donate. But I think it's important that we consider that those people need to be informed about the risks. And when you realize that the lead level for children has now been ratcheted down to 0 is acceptable. So we now have worked with food banks to put labeling on some of the packaging at the food banks that says may have lead particulate. Please be careful about how you use this product. So it's interesting, like something like where we started at, well, let's analyze the data and look at what's going on with bald eagles, sort of, led to a lot of other things. This is one example.
So I'm hearing a bit of a theme that you would never think that physicians, MDs, would be considered not relevant for issues of human disease. But I'm hearing often that in the area of animal disease, veterinarians are often considered as not necessarily a primary relevance in the issues. And I think we've heard examples where, again, understanding the biology of the disease, making a diagnosis, understanding effective treatment or remedies is really critical, not by veterinarians alone, as you point out, Beth, but and others, that this partnership is critical. Steve, I know you've spent your career in trying to manage this space around this tension, as we called it before, between social sides of behavior that are really impacting animal health and managing how to be effective in that space. You want to say a little bit about that?
Yeah, I guess this would be a good point to talk about yet another dimension of our work, which Beth really laid out in the ecotoxicology realm. We have a portfolio that we call planetary health, and I'm sure that's a term virtually none of you have heard of yet, but it's really all about the relationships between environmental stewardship and public health outcomes. Sometimes that's through the animal health channel, but sometimes it's directly. And I probably tell a little bit about the history of this, because this is becoming a new field. And this started really about 2007, 2008. I got particularly interested in the concept of ecosystem services. And just to explain what that is, an ecosystem service is something that natural systems, that nature gives us, that we might not necessarily be accounting for. So the world's fisheries are contributing to the nutrition of millions of people. Forests are sequestering carbon and mitigating climate change. Even if you think about the clean water that you get if you live in Manhattan, the ecosystem service providing that clean water is largely how we maintain the landscape upstream in places like the Catskills. That's an ecosystem service. But I was going to all these meetings about this relatively new field, and no one was talking about health as an ecosystem service, or at least as a derivative ecosystem service. And I started to ask the luminaries in this field, why not? And the answer was, well, we just haven't thought of that yet. So I approached the Rockefeller Foundation, who's one of our major supporters for much of this work, as well as the Gordon and Betty Moore Foundation. I said, look, we need to look at this. And part of it was out of professional frustration that as conservationists, a lot of our moral arguments, our ethical arguments for saving wild nature weren't necessarily resonating, particularly in developing countries struggling to maintain the health and nutrition of their people. But health, to me, is the great equalizer. So I asked Rockefeller for some seed funding and Gordon and Betty Moore Foundation, and we brought together some really neat experts in public health, MDs, some veterinarians, conservationists, and we were asking the question, when is environmental conservation a cost-effective public health intervention? And I remember one of the epiphanal moments for me was at a meeting that wasn't about health. A minister, it was about forests, a minister of public health from a very large Latin American country, which I will not name, he stood up at this meeting very agitated. And he said, I'm the minister of public health of my country. And my colleague, my counterpart, the minister of forests, has made X millions of dollars in logging rights over the past decade. Millions of dollars. But my ministry, the Ministry of Public Health, has spent orders of magnitude more money dealing with the malaria that followed that logging because of the changes in the forest and people migrating into the forest. So for that one country, that was a net loss. But nobody was doing the math. The left hand and the right hand were completely disconnected. And that was really an important moment. We started to realize that from the logging ministry's point of view, those public health costs, all that malaria, that wasn't their problem. That was what economists call an externality. So we started to collect examples from around the world, and we developed a collaboration in Indonesia where the palm oil industry has been burning to clear lowland Sumatra. Those of you who don't know Indonesia, it's among the most biodiverse places writ large on the planet. Last home for orangutans and rhinos and elephants and all kinds of botanical biodiversity, and yet it's being clear-cut and then burned to plant palm oil, which virtually is in every product in the supermarket, or many of them, and in cosmetics. It's one of the most important edible oils. And so they're burning lowland Sumatra, and that smoke, that haze, is going across what we described as the health shed in Southeast Asia and causing billions, with a B, costs in terms of public health, in terms of cardiopulmonary disease, mostly in the very young and the very old in Indonesia itself, but also outside of Indonesia, in places like Malaysia and Singapore. But nobody was, again, connecting those left hands and right hands. And if that doesn't convince you that we have to capture those costs, think about the global pandemic scourges that we're hearing about in the news every day, whether it's SARS or Ebola. Well, for those of you who don't realize it, the biggest scourge that we've been living with as a species has been HIV/AIDS. That came from somebody butchering a chimp and consuming it. That was a transmission from chimps to people. And if you look at what's going on in the Congo Basin, for example, if you are a big timber company, including a multinational, or a big mining company, you are not necessarily right now accountable for feeding your workers. So those workers are forced to either hunt or buy bushmeat in the forests of Congo, in the Congo Basin. And the risk of exacerbating that interface, the more people who are eating wild animals, we know that 75% of these emerging infectious diseases come from wildlife. If we don't mitigate that risk, it's a global peril. So finally, the insurance industry, for example, is recognizing if I'm insuring this mining company or this timber company, I better make sure that they are feeding their workers an appropriate food source, because they could be held liable for the next global pandemic. That is what we're trying to get at with planetary health, is trying to understand and measure the real public health costs of environmental degradation, because if you can't measure it, you can't manage it. And the last thing I'll say on this is, and this is becoming a globally important issue, there's a real equity issue here. So today, if you look at the global health statistics around the world, we are as a species getting healthier in the last 50 years. People are living longer, lower rate of mortality in children under 5, but that's a very coarse evaluation. If you really dig into the numbers, the poorest of the poor, the people who live in the developing world, their health is actually declining because they are most dependent on wild nature for their food, for their fiber, for their shelter. We've replaced wild nature with markets and infrastructure. We can go to the hospital. You can go to CVS or Rite Aid. So our health is going up. So there's right now a social equity issue, but the whole foundation of our new field, planetary health, is that that's temporary, that actually the public health gains of the last 50 years are really built on a foundation of sand, because as we pollute the rest of the world's fresh water and destroy the other half of global forests and acidify the ocean, we've got a tipping point, and that in fact we have an intergenerational equity issue. We are essentially right now, from a public health point of view, borrowing the future from our children. We are living off of, we are mining nature instead of living off the interest. And this whole field is about taking the science quantitatively and working with decision makers to improve decisions in the public health realm, conservation realm, ocean policy, because if we are not counting these public health impacts, we're missing a huge typology of value and making decisions that are actually erroneous. And so we've gotten huge uptake in this. We're now working with WHO, with the whole UN system. We've got 50 other universities partnering with us on something called the Planetary Health Alliance, which is something we set up in partnership with Harvard University Center for the Environment. So although we are calling our umbrella program Wildlife Health Cornell, it really is, not only do we need nature and nature needs us, it's very much sort of that one health message, that this interdependence is a real, tangible, quantitative thing. And that's starting to get traction in circles that otherwise never cared about conservation, because they care about the health of their population.
Terrific. On that passionate but not very reassuring note, I think maybe it would be good to open up to the audience for questions, and I would invite individuals to come to the microphone, perhaps identify yourself, and please ask a question of our panelists. I can always count on Cornellians to ask questions.
You're talking about the role of veterinarians in public and environmental health, and I'm wondering if that field is going to sustain a veterinarian who's graduating these days with close to $200,000 in debt.
So I'll take an initial crack at that. I think, since I've come into academia for the first time, there is, I used to be in the nonprofit sector, and there's this sort of mythology that the vet students get where they're told there are no jobs in these non-traditional pathways. And my experience, having hired many veterinarians over the years to do this kind of work, is that the need is increasing. It's not diminishing. And in fact, to be frank, the levels of compensation for veterinarians doing this type of work is comparable to veterinarians working in the private sector. Working in the NGO sector, we were competing for the same talent as universities and private practitioners. And so we have to be able to offer competitive salaries. So I don't think that is actually going to be a distinguishing factor in terms of where you go as a veterinarian. Now, in some cases, you may need to do more advanced training. You may need to do internships. You may need to do masters. We have a new Masters of Public Health that actually has a planetary health theme. It's university-wide, housed at the vet school, in order to make sure that the next generation has the tools. And as Shirley was alluding to, a lot of those tools are not biomedical. They're social, they're economic, and they're about communication. We spend a lot of our time talking to non-scientists, Shirley, wouldn't you say?
Right, yeah. And you sometimes think, it's a sexy running around, in the bush chasing after animals, but oftentimes the things that really get people moving as well is taking that time to sit down and the connections that you form with people in the various ministries to try and move forward some of the policy that then gets at what you're ultimately trying to do. And so it really is a whole umbrella of skills that helps, I think, certainly in Southern Africa, to move forward some of these things.
And that's really what part of Wildlife Health Cornell is about. We are working not just within the veterinary college, but we've got colleagues across campus in the social science, working on economics. We're creating teams to solve these very wicked, complex problems. But that is the good news. I don't want the planetary health message to be an intimidating one. It's one of real progress and recognition that we can tilt the scales back in our favor in terms of sustainability if we put our best foot forward now.
The question also, I think, raises the issue of students, current students, and how this program affects them and interest. Beth, you may be the closest to the educational side of students. Are you seeing a interest in our students in this area and a movement in terms of thinking about a larger role for veterinarians?
Yeah, generally they're climbing in my windows. I'm on the admissions committee as well, so I talk to a lot of interested students and very nervous parents, and say, no, they're not going to be holding signs. We'll work for food. They'll be okay. I think what we need to do is expand what people think of this being as a career. I think they tend to think of it as a very traditional zoo veterinarian, and I've had 45 students, I think we're up to now, who have worked with my program over the past 7 years or so. I have a bad reputation. They don't like me to talk to students because I hire everybody that I talk to. But a lot of them have gone on to do different things. Some of them have done public health. Some of them have done lab animal medicine. Some of them have gone on to do this kind of field work. I think the students themselves, I think it takes a certain type of personality. They can't decide that they want to work on giraffes and live in Paramus, New Jersey. They have to be willing to go where the job is. They have to be willing to kind of leap off the cliff and take an opportunity and not know where it's going to go. They're not comfortable with not having a 5-year plan usually, and I think we talk to them a lot of how we've come about doing what we do is by accident, and there's not really there is no plan to get my job. And so I don't train people for my job. I train people to be in this area and to figure out what they enjoy doing and sort of how to make decisions to do something in this range, but to fit with their interests and their, lifestyle, what they would like to have in their life.
Other questions? Yes.
Just recently moved into the western South Carolina area around Aiken, and in that area, since I moved there a couple of years ago. Problem. Hello? Okay.
Yeah, it's better.
I just recently moved into western North Carolina around the Aiken County area a couple of years ago, and I noticed that the local Chamber of Commerce has been working on getting a lot of factory farming into the area, where they've been taking down just tons and tons of trees. And are you aware of any of your colleagues working in that area, maybe western North Carolina, where people in the area are concerned about what's happening to the environment can get a scientific base of information that we can use in contacting our governments and local chambers of commerce?
Yeah, I mean, maybe we can talk after the session, but I don't know, in North Carolina in general, one of our main partners in our original thinking on planetary health, and including the trade-offs involved in industrial agriculture and effluence, is Duke University. And so I can give you some context on that. That's what's nice about this. This discipline is not meant to remain in academia. We are working very hard to take the science and, again, move it into partnership with municipalities because it's about action. So I'd love to talk to you more about that.
How are you?
Mari Morimoto, class of 01 vet school. This is more of a comment rather than a question, but the pathologist who finally figured out what's Nile was actually a Cornellian, Dr. Tracy McNamara, class of 82. So another way that Cornell has made an impact.
Absolutely.
Thanks.
Yeah.
Other questions? Yes, please.
Where do you find shy Cornellians?
Sorry?
Where do you find shy
This
Cornellians?
question is for Beth. I have a small farm in the area, and I've been interacting with wildlife a lot more than I thought I would in this process. We have a lot of wild rabbits and a lot of wild foxes on our property, and we found that.
You think those two are connected?
Yes. The foxes also have a taste for our chickens. So we found that there are times of year and there are certain areas on our property where our livestock is safer from natural predators. And largely that's due to the fact that we have flexible fencing because we can't afford to put in permanent fencing. What are you doing in relationship to the ag school and Cornell Cooperative Extension for small farming to educate farmers about ways that you can interact responsibly with your natural surroundings, allow areas of brush growth on your property so that there are natural populations of prey as well as predators?
Yeah, that's really good. We've only been around, 7 years sounds like a long time unless you're building something from scratch, but we haven't gotten into program like that yet. I do have to field a lot of questions for DEC from farmers when they have issues, and one of the problems that we have is that we don't have very good information. What Martin was saying about where does this temper come from that gets into the tigers, is it from the dogs or is it from the other wildlife? Those are some questions we can't even answer in New York. When I look at distemper and how it circulates in New York, I would swear it's also just circulating in wildlife and not crossing over to dogs. And so we need a lot more information about wildlife and domestic animal interactions, because the response is almost always, I want to shoot the wildlife. I want to get rid of the wildlife. And sometimes even that response is, if you know a little bit more about the biology or the science of what you're dealing with, is not going to help you. So we need to understand more about what's happening there and then be able to give better advice. And part of that, the goal of our program, is to be able to get that data. How often do those deer that are walking through your farm pose a risk to your dairy cows? I'm really interested in looking at small birds that hang around the barn. How often are they bringing in, disease, or possibly not? There's a lot of biology that's involved too in wildlife. Some of them don't move very far. So the deer may not be involved in moving diseases from your dairy farm to the next one if it's more than a couple miles away. So it's on my list of things. I have several whiteboards of things that I would like to get to, and that's one of them.
I was just going to say, it's interesting hearing your perspective from an American-based farmer, because these are very similar issues that you would see I was in Nepal last week, and people in the buffer zone of Chitwan National Park that have to deal with tigers, or more importantly leopards, coming out of the park and predating their livestock. The point that kind of rang true with what you just said was the importance of prey populations, and how both you recognize the importance of wildlife, but also the need, if you're going to have carnivores in your landscape, you need to prey for those carnivores. And if you don't have that prey, then you're going to have an increase in competition. And so that's the sort of thing that we see the world over. And that kind of links back to what Steve was talking about the multidisciplinary aspect of what we're doing. A lot of this is about behavior of the people that our wildlife is sharing the landscape with. I'm not necessarily well equipped professionally to be training people to change their individual behavior, their cultural behavior, their social behavior. And so that's why we're reaching out to sociologists and folks elsewhere within the university who they can turn the cube up the other way and look at it from the other perspective. So I don't have the answers, but I know people who will help me get to them.
And I think that we're also, again, it's the same. I think it's universal. That people that live with wildlife, it's not that they don't support wildlife. It's just is the cost so much that it becomes very difficult to live with wildlife. And certainly in southern Africa, with people, every time that there is a foot and mouth disease outbreak, there's a complete ban, and they're stopped essentially from accessing any markets for their cattle, which are critical for paying school fees, for a number of different things. And so it's how can you find solutions that allow these two oftentimes competing land uses to coexist. And one of the things that we're also looking at in terms of this approach that Steve mentioned, this commodity-based or this non-fence-based approach that we're looking to managing disease, is can we also work with farmers to look at options to reduce conflict with predators? So is it something like developing a mobile boma or that goes up at nighttime, and your livestock would go into there, maybe on top of agricultural fields, so there's fertilizer and nutrients, and then to move on. And so tying these two together as well, so that hopefully you see a reduction in the animosity, certainly in some of these areas where it really is life and death for a lot of people.
Can you, we were talking before that the Kavango Zambezi where we work is about the same size as the northeastern U.S. And you said, imagine your kids at the school bus in New York when there are 250,000 elephants wandering.
Yeah, like 250,000 elephants in roughly the northeastern United States. That's what we would be looking at. And for people, it really is very challenging. And so, yeah, it does come back to that. If you could sort of just picture for a moment what it would be like, those types of challenges for people living there. And, I just came back from Southern Africa. I was in a number of meetings where the partner countries in this huge peace park are trying to decide on what are the priorities for the next few years in terms of what they see are priority things to undertake. And there were a number of stakeholders there from government and elsewhere. And I remember sitting there with one of the traditional authorities, a representative from the communities who had been sent to represent them, a very distinguished man, elderly man. And I was sitting there after dinner with him one evening, and he had been listening to all these different ideas and the ideas about this commodity-based approach that might allow them to have access for their cattle for markets. And he reached across to me, and he put his hands on top of my hands, and he said, "We need help. We need help. And what you're proposing sounds like something we need to look at." And it was incredibly powerful because in the African tradition, that is not something that you see happening very often. And so it really instilled in me that we're on the right tracks, and that there's some real hope out there to get this to work.
Hi.
Please.
I was just curious, back to the lead in the food bank thing, were people offered testing, or was that followed up down the line as to how many people had lead poisoning from that?
From the hunter or food bank? From hunters. So there have been very, very few studies done on this, and there were a couple of Midwestern states that were able to do some blood testing on people that showed that there is a little bit of a higher lead level among hunting families. If you think about it, though, one of the things that we run into a lot is we don't look for it, and so we don't know. The Department of Health said, well, we don't see a lot of lead poisoning, but it's like, how often have any of us as adults ever been asked to have our blood tested for lead? My children were tested at 1 and 2, which is required in New York, but not after that. Probably not a lot of people feeding their 1-year-old deer jerky. Anyway, so that's a question. We just scratched the surface of this last fall, and hunting season is the fall, so we managed to get some information on packaging at the food banks, and we have some information pages on the DEC website talking about non-lead ammunition. And we're trying to make an argument for non-lead ammunition in terms of, you know, it being just as good, maybe a little bit more expensive, but safer for those people. It is again, culturally, it is a touchy subject to go to hunters and say, you have possibly been lead poisoning your family. So we're trying to figure out how do we deliver that message in a way that does not get a negative reaction. I've heard a number of different arguments. One is that they talk about ballistics and whether or not it's as effective as lead in terms of how it hits the animal. It's a little bit more expensive. And then there is a political cohort who feel like any attempt to regulate what they have access to is not going to fly.
The first step.
I think that I used to work with birds of prey, and I know this has been a big issue out in the western states with the California condor and the recovery of the California condor, and how it's been, things have been handled differently in the different populations and in the different states. I think in like Arizona, it was very much working with the hunters and coming from inside the hunting community and getting hunters to voluntarily, rather than sort of the iron rod that was really how it was managed in California, which didn't go down so well.
Yeah.
I think maybe we have time for one or two more questions, please.
Thank you. Joe Regenstein, class of 65, Food Science Department. Steve, interested in this processing of meat. The issue of aging meat is a very complex business, and of course some of the animals, I presume, are dark cutters, which aren't going to reach pH 6. So, how are they beginning to implement this? How is this, in terms of temperature control during aging and some of these things, how are you trying to work with the food science aspect of this if you're going to put that responsibility on us?
I'm glad you asked that. We're actually, with our new support, our core funding from the Rockefeller has now been supplemented by the Atkinson Center specifically to bring Cornell food scientists with us to Southern Africa. And our guidelines are coming down from the OIE, the World Organization for Animal Health, where they actually mandate that the pH gets checked in the longissimus dorsi. It's very specific, based on a standardization. And so if we follow that protocol and the pH drops accordingly, then that is deemed acceptable. Now we're also doing, there was a pilot project in Namibia actually looking at the samples themselves to make sure that the virus was not ending up in the final product. So it's all done with a HACCP approach, hazard analysis, critical control points, and so it's very much grounded in that tradition.
Thank you.
Time for one more question.
So I just while we're waiting, I'll just observe that, as you heard, I think all of us started out as hands-on veterinarians and clinical veterinarians, and as over the course of our careers to solve these big problems, and I think the students are benefiting from this, we all end up moving, at least in part, towards the policy dimension in order to have that sustained impact, right? So we're drawing on our clinical hands-on work, which many of us are still doing, but in order to translate that into real fodder that decision makers can use, we end up meandering, if you will, into the policy area. And I think it's been helpful for the students to realize that that is another thing they can do over time.
Yeah, and I'm hearing social science, the importance of social science. Of course, these can be done collaboratively, but to really be effective, social science, politics, the political dimension of this is extraordinary, and economics of course, epidemiology, but economics and really understanding what and quantifying the impact of some of these changes and some of these activities, as you point out. And so are we in this process? It sounds like you've, Steve, several times referred to partners, food science, social scientists. Are we forming these kinds of consortia that can really affect policy in the future?
Absolutely. I mean, I think we have a number of examples of where some of the work that we've done has now been adopted by entities like OIE, like FAO, and I think in New York, your examples and your impact on DEC are very tangible right now in terms of even in the relatively short time that the program has been underway. So that's what we're shooting for. And I think one of the other things that the vet students are benefiting from is I remember sitting in class very early on in the 80s thinking, that conservation was about animals, but it's about people. And much of what we do is about trying to find ways across cultures to make wildlife, a socially acceptable land use choice, an economically rational land use choice. It's often most important for me to convince a minister of finance that this landscape should still have wildlife, as opposed to a minister of the environment who already believes that. But in our experience, the weakest part of any government, almost anywhere, is the Ministry of the Environment. But if we can convince the Public Health Ministry or Department, or the Finance Ministry or Department, that conservation is serving a greater sustained public health good, then we win. And that's really what we're trying to do across this portfolio, is make science-based arguments that resonate beyond the choir, if you will.
Terrific. And I know this is a feature of the Atkinson Center. And so that gives me an opportunity to thank our panelists. So a round of applause for them. And I also just want to thank the sponsors for this event, the College of Veterinary Medicine and the Atkinson Center for a Sustainable Future. And thank you all for participating today. And I hope you have a wonderful alumni weekend. It looks like the weather's going to be very nice. Thanks very much.